My next guest was part of the 17-member CDC Vaccine Advisory Committee before he was actually dismissed by HHS Secretary RFK Jr. He says this panel is in chaos and is probably not savable under this leadership. Gilling's distinguished professor in public health at UNC, Dr. Joel Brewer, joins me now. Dr. Brewer, great to have you. Noel, I apologize. You are watching this new panel make recommendations on important vaccines without you. What do you think of what you've witnessed so far?
I'm happy to have other scientists at the table
Thank you,
doing good
Josh.
work. Unfortunately, they're not doing good work. The decisions so far have been chaotic and not based on a thoughtful process. So they reflect bad processes and a bad outcome. So I'm not happy to see that. And I'm not just a sour grapes former member. This is the opinion held by your family doctor, the person that you go see who treats you. So we need to have credible recommendations, and ACIP is no longer the place to get them.
Well, look, we even had a respected medical expert who's been sitting in the room. He's supposed to be there to help advise or give input to this panel, and he's throwing up his hands because they kept muting his mic. So there are a lot of people like you speaking out, and it's not sour grapes. It's absolute pure concern for Americans' health. So I want to ask you this. I've been asking everyone, whether they've been in the room or they're sitting on the sidelines watching it all go down, who are the American people supposed to listen to?
You hopefully have someone you've been getting your kids vaccinated with, or maybe yourself, you've been going to see a primary care physician or another health practitioner. Go talk to that person. You don't need to listen to these folks in that room. They're having some very strange conversations that involve what ifs and mouse models and all sorts of hypothetical situations that aren't matching what real clinical medicine is about. It's about keeping people safe over the short term and the long term, and your doctor knows about that, or your healthcare provider, or maybe you're seeing a nurse practitioner. Whoever you're seeing, those are the people to go talk to. They know you, they know your family, and they know what's good for you.
Right. They know the science. They know the evidence. The panel delayed today's expected vote on the Hep B vaccine for newborns. Do you know why? Do you think it was, I don't know, fear of backlash or just didn't understand Hep B? I mean, talk to us about your thoughts and also why this vaccine is so important.
Well, the reason why we give people hepatitis B vaccine is to prevent cancer. It's a cancer-preventing vaccine, and it's an important one. Before we were giving the vaccine at birth, people were getting there were about 20,000 cases a year of hepatitis B related disease. And now we're down to about 20. That's a really big success story. And we don't want to have people exposed to that. About 90% of kids who are exposed to this stuff end up getting some kind of illness as a result. So that's something we want to avoid. Now, as for why they delayed, it's all a bit of a mystery. I do note that they went away and then all came back in lockstep. So it may be that they want to do things in a more controlled way. And that may involve input from people who are not at the table and who are talking quietly from the sides. That's what I suspect has happened, is there's some whispering going on and some stage managing of their latitude and what they're doing.
Yeah, good insight. There's this new study out also today that estimates universal COVID vaccinations could save thousands of lives. What happens if this panel votes to restrict access to COVID shots?
One of the things we know about access is that it's the big lever for vaccination. Even little changes can increase vaccination rates by 5 or 10%, and that's on the good side. And the little changes like requiring a prescription or making people go to a separate location, those things can drag uptake down quite a bit as well. So the actions by the committee could have really serious impacts. They have voted, as I understand it, to approve the vaccine for folks who are age 65 and older, but even all the way down to age 6 months with informed decision making. So shared decision making, and that would be a good thing if that sticks, to ensure that all Americans have access.
All right, Dr. Noel Brewer, sure appreciate your insight and your interview today. Thank you, Doc.
Thank you.